Should you stretch your hip flexors for back pain? The truth is, not always. Don't just stretch because you've heard that you should. Test yourself first. If you're tight, stretching can help. If not, you're better off focusing on what's really limiting your movement or contributing to your back pain. Let me show you how to figure it out. Hip flexors are often blamed for back pain because they attach directly to your spine. When they get short and stiff, which happens a lot from sitting, they can tilt your pelvis forward. That increases the arch in your low back and forces it to take more stress. But instead of guessing, here's how you can find out if stretching will actually be beneficial for you. Lie on your back at the edge of a table or bed. Hug one knee toward your chest and let the other leg hang down over the edge. If the thigh of the hanging leg doesn't drop down far enough to touch the surface, your hip flexors are staying short and holding your hip in a tight position. If that hanging leg slides out to the side instead of staying straight, your hip is compensating, another sign that the hip flexors are restricted. If your low back pops up off the surface or feels like it's arching, your spine is working overtime to make up for the tightness in the front. But if your thigh drops down naturally, stays in line, and your back stays relaxed against the surface, your hip flexors are not the issue. By the way, if you're finding this video helpful, please like and subscribe so you don't miss the next video. So here's the takeaway. If your thigh won't drop, or your leg drifts, or your back arches, stretching may help. If your leg drops freely without these compensations, stretching probably isn't going to change your back pain. Now, if your test shows that your hip flexors are tight, stretching can definitely help. But here's the thing, stretching is only one piece of the puzzle. Check out my free mini course with 4 back-saving techniques I teach my patients on day 1. Link in the description below. If your test was positive, here's a simple stretch you can try. Start in a half-kneeling position with your back knee resting on a pillow or folded towel. Squeeze the glute on that side to tuck your hips, then stay tall through your chest as you gently glide forward until you feel a stretch in the front of your hip. Hold for 20 to 30 seconds, then switch sides, keeping it gentle, a stretch, not pain. And here's an easier option. You can actually stay right in the same position as the test. Just let your leg hang down off the edge, relax, and feel that same stretch in the front of your hip. No kneeling required. But if your test was negative, your leg dropped comfortably, your low back didn't arch, then stretching your hip flexors is probably not the answer for you, and you're best off focusing your attention elsewhere to address your back pain. So again, don't just blindly stretch, test yourself first. Once again, if you want more spine-safe strategies you can start using right away, check out the link below for my free mini course with 4 back-saving techniques. And don't forget to subscribe so you don't miss the next video. I hope this video was helpful for you. Thank you for watching today.